Hi, I'm Morgan Gable in the Advocacy Department at LeadingAge. It's still cold in most parts of the country, so what better way to warm up than to curl up next to your fireplace and read this month's HCBS report. This month's report is full of information that you need to know, including up-to-date information on upcoming LeadingAge Home Health face-to-face webinars and answers to frequently asked questions on this new requirement. The other big issue is that on February 14, 2011, the President released his budget. The budget includes increases in funding that covers some adult day services and some in-home programs through the Older Americans Act. Home and community-based supportive services increased from $368 million in the continuing resolution, commonly referred to as the CR, for 2011 to $416 million for 2012. The National Family Caregiver Support Program would be increased from $154 million in the CR for 2011 to $192 million. The Lifespan Respite Program would also be increased from $3 million for 2011 to $10 million for 2012 under the President's budget. While we appreciate the President's commitment to caregivers, persons with disabilities, and older adults, we are concerned about his call to cut the Community Services Block Grants program by 50%. We have heard from some LeadingAge members who rely on this funding for a variety of activities. Also, we are concerned that the President chose to keep meals programs, both congregate and home delivered, at the same current funding levels, even as the need for these programs continues to increase as older adults struggle with the lasting effects of the economic downturn. Unfortunately, the House of Representatives did not agree with the President's proposed increases. On February 19th, the House passed H.R. 1, which includes reductions to the Section 202 and Section 811 housing programs, and to community services block grants, which many states use for home and community-based services. Grassroots advocacy is more important now than ever. We are urging all LeadingAge members to reach out to their senators to tell them to reject the House bill and to preserve funding for programs serving vulnerable older adults. We have letters posted on our Contact Congress section of the website in order to make it easy for you to let your members of Congress know that even in tough fiscal times, we cannot cut programs upon which older adults and people with disabilities so desperately rely. We also have a detailed chart showing the difference between the President's budget and the continuing resolution. Please contact us if you are interested in this information and have not yet received it. With so much going on at the federal level, we encourage you to keep up to date with the postings on our website, our blog, and through our various listserv messages. Our programs are going to continue to face tough obstacles, but together we can keep up the fight to ensure that we have adequate funding to continue to serve the older adults in our programs. As always, please let us know if there is something that we can do to help you face these challenges as we all work together to create the future of aging services.